Are you needing to study for the oral addiction exam? You've come to the right place. We are diving into the 12 core functions and 46 global criteria for addiction treatment and what you need to know to ace your oral exam. Whether you are just getting started or preparing, I will walk you through the key elements, share my personal experience, and tips to stay calm and focused during the oral exam. The 12 core functions form the foundation of substance use disorder treatment and guide how professionals manage care. Along with the 46 global criteria, these functions are often used to assess candidates through oral or written exams. Each state may format their exams slightly differently, so it is important to understand how these elements fit into your specific process. Here is a quick overview of the 12 core functions: screening, intake, orientation, assessment, treatment planning, counseling, case management, crisis intervention, client education, referral, reports and record keeping, and consultation with other professionals. Each of these functions break down into global criteria, guiding the practical steps you will take at every stage of the treatment process. For your convenience, I have included a downloadable file in the description that lists all 12 core functions and the 46 global criteria. Be sure to grab it as a reference while you prepare. Now let's talk about what you can expect during the oral exam. I will share a bit about my personal experience to help you feel prepared. The oral exam is typically based on the case study that you have already written and submitted. Depending on your licensing board, you might need to write your case study on a current or past client. Make sure to check with your board for specific guidelines and the exact format they require. One thing that surprised me during the exam was how neutral the examiners remained. They are trained not to give away any facial expressions, so you will not know if you're doing well or not based on their reactions. This can feel unsettling, but it's actually done to remove bias. All you need to focus on is answering the questions clearly and confidently. Do not get distracted by trying to read their expressions. When I took the exam, I had 45 minutes to complete it. The first 5 minutes were for instructions and did not count against my time. After that, I had to answer 12 questions, one for each core function, along with the corresponding global criteria. The questions went in order of the 12 core functions. For example, you might get a question like, give an example of how you would use screening with a client and explain the criteria that are part of the screening process. Here's the good news. Preparing is everything. I created a detailed study guide and committed it to memory, which helped me stay calm and focused during the exam. Memorizing the material gave me a sense of control and prevented that blank mind moment that we all fear. If you prepare thoroughly, you will feel much more confident when it comes time to sit before the panel. If you are feeling overwhelmed, I got you covered. I created prep materials based on the exact strategies I used to pass the oral exam on my first try. These materials include step-by-step instructions to guide you through the process, helping you walk in confidently and pass on your first attempt. If you are interested, click the link in the description to learn more. Remember, you got this. Stay focused, prepare well, and trust in your knowledge. Be sure to download the 12 core functions and the 46 global criteria from the link in the description. Good luck.